I'm Carol. I'm here for my colonoscopy. I feel like if somebody offered me the choice, get audited by the IRS or have a colonoscopy, I might just go with the IRS. Wish you luck.
Hey, Carol.
Dr. Strom.
How are you?
Good.
So tell me your family history again about who had what.
Well, my grandfather had colon cancer. I had a colonoscopy in 2003 to be preventative.
Correct.
And they found a polyp,
Right.
which they removed.
The procedure's going to take 10 to 15 minutes.
Yes, I know.
And you're going to be perfectly fine.
I know that in your hands, Dr. Carey Strom, I will be.
We go way back.
We do go way back. And when I say way back, I mean really way back when you have a colonoscopy. Am I right, folks?
We're going to start doing Carol's colonoscopy now. So what I'm doing is trying to navigate my way all the way around to the end of the colon. See the bluish discoloration? That's the liver pushing on the colon. And then we're getting down all the way to the end. Now, I'm getting into the small intestine. Now I'm going to do the exam on the way out. So we examine the segment, we suck the air out, and then we go to the next segment. Carol will have no recollection of this when she wakes up and will feel terrific.
Carol and Dr. Strom join us. So a little scary sharing your colon with the entire world here?
Well, I'm actually very excited about it. I mean, the world premiere of my tush. Oh. Come on. How great is that? Yeah. No, I'm really so proactive about health. And I've had friends who have sadly died of colon cancer only because they weren't doing these preventative things. And it's so preventative to, you know, not have colon cancer. Why not do it? From a female perspective, the prep is horrible, but you lose so much weight. It is fantastic.
Hey, now,
Yes.
now you're talking.
Yeah, right?
And you know, you hit on a good point because I have a lot of patients every year who are like, do I really need to get this? And they keep putting it off, putting it off, putting it off. So I'm glad you're on here. Dr. Strom, can you talk to us just a little bit about the importance of your screening, your very first colonoscopy?
This is one tumor that we can actually prevent. Colon cancer screening.
And I love that if you get your colonoscopy, and we'll use 50 as an example for a normal risk individual, and everything goes well, 10 years before you would have to have another test done unless something changes, right?
That's correct.
So it's not one of these where you go get it, you got to go every year. It's getting that clean bill of colon health. It's a nice reassuring thing, is it not? And it gets back to that, don't you feel empowered?
Yeah, absolutely. I mean, and also having a family history. You know, my grandfather had colon cancer. I feel really good that at 47, I had my first colonoscopy, which was recommended by my doctor. And it turned out to be great because there were polyps there that, had they been left unchecked, could have, you know, possibly become cancerous.
You did write a book called How to Succeed in Business Without Really Crying.
Yes, I did. Pick it up because it's good for anybody of any walk of life to, you know, empower your life and do really smart things in your life, like being preventative about this kind of stuff.
Well, and thank you for teaching us how to succeed when it comes to our health, because prevention is so very important. Dr. Strom, Carol, thank you so very much.